Good morning, everyone. Welcome to the Hindu Physicians International Distinguished Lecture Series. Today is Sunday, December 7th, 2025, and we have a distinguished physician who will be speaking to us. May I have the PowerPoint presentation, please? May I have the PowerPoint presentation on the screen?
Adityanji, PowerPoint is running.
Okay. So let's move on the slides. Hindu Physicians International is a dharmic, faith-based charity that focuses on seva. We are a new entity. We are just starting to do local seva work. We have a board of directors, an international advisory board, as well as an executive committee. We are working with the young physicians so that they join us to work for the organization. Our most recent addition to the executive committee is Dr. Shalini Arora Chaudhary, who has joined as the honorary director for fundraising. We believe that Sanatan perspective helps us serve the humanity. As I said that we have focus on seva, so we shall be continuing to make that emphasis in future months and years. Our distinguished speaker today is Dr. Nisha Manikantan, who has a BAMS degree.
I saw him go that way
From
the store, but he said he's working in the back.
Can everyone please mute yourself so that there's no sound interference? She has a BAMS degree. She is very widely traveled and research. So she will be talking about bridging Ayurveda with modern medicine. In the PowerPoint presentation, you might have seen a couple of pictures. Recently, Hindu Physician International went to Cleveland Greater Food Bank and sponsored 12,000 meals to families that are food insecure and food challenged. So this is a kind of activity we are doing in the local community. And we would hope that all members of Hindu Physicians International, wherever they are, will be taking local seva projects. So I'm not going to continue further, and I will be giving the platform to Dr. Nisha. But before I do that, I would invite somebody else to talk a little bit about the seva project, and that is Professor Narasimha Penenti, who is Professor of Psychiatry in New Jersey. So I'm going to be ending my introduction. I would invite Professor Narasimha Reddy Penenti to talk about his seva project before we invite our esteemed speaker. Narasimha Penenti, kindly take the stage.
Okay. Are you able to hear me?
Okay, go ahead, Narasimha.
Okay. Good morning, everyone. Thank you, Adityan. With regard to the seva, I would just like to kind of share my own individual approach and how it relates to the project which is being done. Seva as a project is at one level where we set aside some time to do a particular project and accomplish something. But seva as an attitude for us to individually develop is something which I think is the next step. And that is what I personally try to do in terms of my own approach. As a result of that, wherever there is an opportunity to be able to do some seva, that is where something is done. It is not important how small or how big. So the particular project that I'm going to talk about is in Telangana, in Karimnagar district in India, which is the village I come from, and we have a long association there. There are 3 primary schools there. No, there are 3 schools, 2 primary schools, there are 1 middle and high school, a total of 150 kids over there. And what we do there is supplemental nutrition for all the kids who are going to these 150 kids who are going to the government school over there. And the supplemental nutrition is given on the days that the government does not give them nutrition. The government gives them eggs for 3 days a week and the remaining 3 days. So in consultation with the school principals, we came up with a plan in terms of we have a budget and we have come up with a plan. Typically, it is about 6 rupees per kid per day, and that has been going on now for almost like 4 years ongoing. As we continue the association with them, then this year they found out that their water purification system was not working. So that is something that was kind of replaced. And so this is, I just don't want to take too much of time, but this is one thing that we are doing. But also, one of the things for us all to kind of keep in mind is that there is a significant amount of undernutrition and malnutrition in India. And we as physicians can increase awareness about this in our communities. So one thing we do, if it is our driver, if it is a chowkidar or whoever who is there, whatever salary we give, in addition to that, we say if they have any kids, the kids will we give money to give for the kids for milk for the entire month. So this is nothing to do with their salary. This is something we do so that that the kids are getting milk, or if they eat eggs, they are eating eggs. I will stop at this. Adityan, not take much time. Thank you very much.
Thank you, Professor Narasimha Penenti, for giving your experience with Seva and the local Seva projects you are running in Karimnagar district of Telangana. Now it's my honor and pleasure to invite Dr. Nisha Manikantan to give her distinguished lecture to this audience. She'll be speaking for 35 to 40 minutes, followed by that there'll be some question and answer, and then we will end the session. So Dr. Nisha, kindly unmute yourself, and here we are for your presentation.
Namaste. A very good morning to everybody. I'm very happy to be here to share with you some of the thoughts. And I think this is a great opportunity to come together and for bridging the 2 worlds, the integration of Ayurveda and modern medicine. Yeah. Am I audible? You can hear me, right?
Yes.
Yeah.
You are.
Okay. So a very profound moment in the evolution of global healthcare, where an ancient wisdom and modern science are no longer opponents, but we are partners. So this healing tradition, which have been there for over 5,000 years, now it's being rediscovered by the world, because we are all looking for holistic, personalized, sustainable health solutions. So here we can talk about something which I believe will shape the next era of medicine. So the integration is like not as an alternative and not as a competitor, but as a complementary, evidence-informed, patient-centered partnership. So these are two worlds, right? But one vision. And we are all looking for a healthier and more holistic future for humanity. So let's see how these worlds are different yet similar. Suppose two physicians are meeting for the first time. They modern medical physician and Ayurvedic physician. So one speaks the language of biomarkers, imaging, pharmacology, and randomized controlled trials. And the other speaks the language of energy, doshas, agni, prakriti, and subtle energy systems. So at one glance, it seems they come from entirely different universes, right? But if we look closely, both are guided by the same mission: to understand the human body, to prevent disease, to restore balance, and to help people to live long, healthy, fulfilling lives. So for recently, for centuries, these two worlds existed side by side, but rarely crossed the paths. But today, with all these chronic diseases rising, the strain of the mental health, and the global burnout at historic levels, the world is recognizing that neither system alone is not enough. So the future is integrative, future is collaborative, and the future belongs to both. So why the integration matters is, as all of us know, it is not just interesting, but it is urgently needed because of the global health crisis we are facing. We are facing an explosion of lifestyle diseases, autoimmune disorders at record levels, stress and burnout like global epidemics, and the longevity is outpacing the health span, and medical costs, rising medical cost. And we see a population which is disconnected from preventive self-care. And we are all practicing medicine in one of the most rapidly shifting healthcare environments in the history. Like as medical doctors, what we face is, one is, as I said, the chronic diseases, and that do not respond well to conventional interventions alone. This is a reality. And patients increasingly demand holistic and lifestyle-driven care. They know about it. They have a lot of hope in that. And burnout, not only in the patients, but within our own profession, we see the burnout. And other complex conditions influenced by stress, behavior, environment, and long-term physiology. So a health system that often focuses more on disease management than creation. This is what we are right now. So in this environment, both the practitioners and the patients are very increasingly exploring the integrative modalities. So I am from Ayurveda background. I am a graduate in Ayurveda and I am practicing for 35 plus years. And here I would like to discuss Ayurveda as not an alternative, but as a clinically complementary model that can enhance patient outcomes when paired with evidence-based medicine. So we are sharing our goals. It is to improve patient care, reduce disease burden, and support long-term human health. Modern medicine excels in acute care, emergencies, infection control, surgeries, and life-saving interventions. And Ayurveda excels in prevention, long-term balance, personalized lifestyle, and understanding mind-body connection. So when you combine the two, you get better prevention, better long-term disease management, and more sustainable habits, deeper patient engagement, and more effective healing. So this is a healthcare system that treats humans, not just symptoms. So that is why the integration is a necessity. And when you look Ayurveda's framework, this is a science which is wrapped in simplicity. No, it is often misunderstood as a purely traditional or spiritual science, but in reality, it is a highly structured, observation-driven system of biology and physiology. Everything is documented by years, by centuries of experience. And those documentation happened thousands of years ago. So we base our studies, our treatment principles, everything on this documented science. And the core Ayurvedic principles, which some of you may be knowing and some of you may not be very familiar with, which align with the modern sciences, the constitutional typing, Prakriti. Ayurveda identifies individual biological patterns, something modern genetics and epigenetics now confirm as essential. And Ayurveda describes functional energies, physiological tendencies. So today we can compare them to metabolic types or homeostatic patterns which are disturbed. And very unique concept called Agni, that is the digestive fire and the metabolic capacity. And what I understand is modern research calls this gut microbiome health, metabolic efficiency, which helps in the inflammation reduction. And another concept or another theory of Ayurveda is Dinacharya, the daily rhythms, and Ritucharya, the seasonal rhythms, which can be parallel to the modern circadian biology or chronomedicine. It is both sciences are based on two different aspects. But still, we can say it's something which goes along. And then there is a very unique concept of ojas, the vitality and resilience, comparable to what we now study as maybe immune robustness, stress resilience, and cellular health. So we cannot call Ayurveda an old medicine. It is a timeless medicine, rediscovered through what the time demands. Now we are trying to rediscover through the modern scientific lenses. And what modern medicine brings, according to my understanding, is precision, technology, evidence. And modern medicine has transformed the world with diagnostics, imaging, emergency care, epidemiology, pharmacology, the evidence-based protocols, large-scale clinical trials. So what we have to gratefully acknowledge is without modern medicine, the infant mortality would rise, life expectancy would drop, surgical survivability will be difficult, infectious disease would dominate, trauma care would be impossible. So this is the gifts of modern medicine, invaluable gifts of modern medicine to the world. And maybe more. And Ayurveda do not replace this. It enhances it by addressing what modern medicine very seldom addresses, like long-term lifestyle patterns, stress-induced illness, emotional imbalance, and the nutrition which is suited to individual constitution, preventive care, mind-body integration, root cause analysis, and together they form a complete circle of healing. So, where can we meet? The key integration zones, according to my understanding, is in chronic disease management. Like Ayurveda principles help manage diabetes, hypertension, digestive disorders, and autoimmune conditions, PCOS, arthritis, obesity, and while modern medicine provides diagnostic monitoring, medication stabilization, and medical supervision, and together the outcome of this coming together will be like groundbreaking. And in the area of mental health and stress management, Ayurveda, along with yoga, they have tools like breath work, meditation, yoga, other yogic interventions, and lot of herbs. Like one example is ashwagandha, and daily routine regulation, which addresses many conditions like decision fatigue and disruption in the chronobiology. So, and modern medicine offers psychotherapy, medications when needed, neurobiological understanding of the whole situation. So, when in this area, in the area of mental health, if we can come together, we can support the mind and nervous system more completely than either alone. This is one of the possibility. And in gut health and metabolism, Ayurveda has long emphasized the digestion as the root of health. So today, microbiome science confirms it. And so an integrated approach in this area can support irritable bowel syndrome, the GERD, food sensitivities, and metabolic syndrome. So this is another area where integration can do a lot of magic. And preventive and lifestyle medicine. This is a domain where Ayurveda is thousands of years ahead. And this is the only science which has the science of wellness. There is no medical science which addresses wellness. So Ayurveda, if you divide Ayurveda into two parts, one part is the therapeutic science, where illnesses are dealt with. And the other part, the initial part, is the science of wellness. So wellness is addressed and preventive science is given a lot of importance in this area. And integration can also happen in post-operative and rehabilitation care, where Ayurvedic therapies can support faster recovery and lower the inflammation. It can help in better mobility, mental resilience. Another area is women's health. From menstrual health to menopause, integrative care is very, very effective. And even in the pregnancy care, antenatal care, postnatal care, and even before the progeny is born, Ayurveda has offerings to increase the health of the sperm, virility of the sperm, of the ovum, and preparing the uterus to receive the progeny, and help in bringing out the best of the progeny, and followed by antenatal care and postnatal care. So the integrative care in women's health will be very profoundly effective. So we all talk about evidence. There are a lot of research supporting Ayurveda. Like modern research institutions are conducting studies on Ayurvedic herbs, like hundreds of herbs have been studied, and also studies on Panchakarma therapies, studies on yoga and meditation, Ayurvedic dietary systems, and gut health. Studies are there in circadian alignment, like Dinacharya. So the universities who are right here in US, the Harvard, Stanford, John Hopkins, and other institutions across India and Europe are validating what Ayurveda has for centuries. So we don't have to choose between intuition and evidence. We can have both. So it is an intuitive science, but recorded systematically. And with the modern research platforms available, we can have the evidence too. And the practical applications, let's see how the integration looks like in real practice. So imagine a patient walking into an integrative clinic. So the step one can be modern diagnostics, blood work, imaging, the vitals, the medical history. And second is the Ayurvedic assessment. This is what we do. We have in our hospital, Sri Ayurveda hospital, we have integrated approach in cancer care. So this is what we follow there. So we have a team of both doctors from both sides, both medical sciences. So step one is the modern diagnostics, and step two, the Ayurvedic assessment, Nadi Pariksha, the pulse diagnosis, Prakriti analysis, and the condition of the doshas, condition of the Agni, stress profile, lifestyle mapping, all in a very detailed way of assessment is done Ayurvedically. And then we have a blended treatment plan, conventional medication wherever is needed, and herbal support, panchakarma support, breath work, mind-body protocol, the dietary support, and dinacharya support for sleep alignment, and also aligning the energies in the body. Only if the energies in the body is aligned, healing happens. Only if the mind is addressed, healing happens. Only if the stress is addressed, healing happens. So all this put together forms a complete medicine, complete approach to healing. So patients feel they are seen, they are heard, they are supported, they are not just treated. So that is how the integrative approach looks like, and that is how, according to me, the integrative approach should be. And we have challenges, challenges, what must be addressed for true integration. So integration is powerful, but it has challenges also, misconceptions on both sides. So understanding each other, how the sciences work, that should be the first step. And standardization of the herbal, the Ayurvedic products, very, very essential, because the world is now standing where a strong evidence-based approaches are valued. So there is a need for more robust RCTs, clinical trials, and training gaps among physicians. The training should be done for the integrative approach. Like we train our whole team because it is a very rare area we are addressing with an integrated approach. So all our physicians are trained, and everybody in the team understand what is the gain, what is expected, what needs to be addressed, all that. And then policy and insurance limitations is a big challenge. Then we must not ignore these challenges. We must address them with honesty and collaboration. So I feel the vision forward is to build a holistic healthcare future. So the future of medicine is collaborative, interdisciplinary, evidence-informed, root cause focused, and definitely patient-centered. And preventive science also need to be addressed in a very intelligent way. Like in cancer care, we have a very strong protocol for secondary prevention. When the patients are healed out of cancer, now everybody has this fear of recurrence, and nobody can say whether it recur or not. So this is where Ayurveda comes into picture. Very strong secondary prevention protocol, we say, we deliver. So just imagine the hospital with physicians and Vaidyas working together, joint medical records for integrative treatment, lifestyle coaching into the standard care, yoga therapy departments, and prevention clinics, and the nutrition and dietetics tailored into specific needs like Prakriti and the Doshik condition, the condition of the Agni, and mental health programs, blending ancient and modern tools. So this is our dream. And I feel it is already happening in pockets around the world. So now we must bring it into the mainstream. That is, as physicians, this is our responsibility. So we are at the threshold of this new era. And this era, like, no, we stop asking and talking and writing which system is better. We should start asking, how can these systems work together for the great good? Ayurveda offers wisdom, modern medicine offers precision. Together, we offer wholeness. And whatever your role is as a clinician, researcher, policymaker, or educator, or even patient is crucial. The shift begins with each of us being willing to open the dialogue, expand our understanding, and create bridges instead of boundaries. So let's move forward with curiosity, collaboration, and compassion. Because the future of healthcare is not divided. The future is integrative. It is holistic. And let this integrated approach be the future of humanity. So I would like to have some conversation.
Thank you very much indeed, Dr. Vaidya Nisha Manikantan, for a very, lucid lecture trying to emphasize the importance of Ayurveda and approaches to bridge it with what we call modern medicine or modern medical sciences. There are a lot of questions in the chat room, and I will start taking those questions. But before I take those questions, I will throw a question at you.
Yeah.
It is my individual belief, and I'm trained in modern medicine, I'm a practicing psychiatrist. It's my belief that Ayurveda is the mother of all modern medicine. Would you like to say something on that?
Yeah, I believe it too, because it existed thousands of years ago. And because those days also humans were there and they faced diseases, maybe in a different way. But from the documented text, we see almost all the conditions were there, and even surgical conditions. So the science developed by finding out the herbs which can address all these conditions. And Ayurveda purely was based on herbs, of course, on minerals also, but majorly herbs. And these herbs, which we see, very innocent trees which are standing there, they are very potent medicines. Like we know there is a lot of rigorous clinical trials evaluating the Ayurvedic herbs such as turmeric, ashwagandha, and many more. So this was identified, the potency of these medicines were identified, and it was used in medication. And also Ayurveda has a proper foundation. It has its own physiology, its own pathology, how a disease develops, and then at different stages, how is the manifestation, and a very clear diagnosis process and prognosis. So I believe those days this was the only medicine which with a proper foundation of treatment principles. There can be different parts of the world. There maybe some herbology existed. People knew, okay, this medicine is good for this. But I have traveled across the world. I have spoken to physicians in different parts of the world, healers. So this is my understanding. So possibly that is a possibility. This is the mother of medicine. And then as days advanced, modern medicine developed, because we are continuously evolving. We are not standing where we are. And modern medicine has unbelievably advanced. Even
just to emphasize,
yeah.
on this platform on Hindu Physicians International, we had a lecture by Professor Yash Gupta, who is an FRCS based in UK. And he went over certain Ayurvedic treatises like Sushrut Samhita, which talks about, operations of rhinoplasty, repair of cleft lip and cleft palate, and surgical instruments that are described in that particular treatise, Sushrut Samhita. So it's a question of how we perceive science. It was not just about medicine, but also about surgical procedures that were quite well advanced at that particular time. So just want to emphasize that Ayurveda is not just about, medicinal treatment. It had also books on surgical treatment, including plastic surgical repairs at that point in time. And this has been documented.
Yeah.
So we move on to other questions.
Yes.
But before that, there is a request from us, the Hindu Physicians International. Please visit our website, hinduphysiciansinternational.com. There's a membership page. The membership of Hindu Physicians International is free. If you are a physician, if you are a resident doctor, if you are a medical student, you can join as a medical personnel. For other allied disciplines, whatever they are in health sciences, again, there's a membership. And if you are a community volunteer, there's a page for community volunteers. So all the memberships are free. Please, you are welcome to join Hindu Physicians International and work in collaboration with us. So the first question I'm going to read is from Geetanjali. Are there any case studies to show the complementary benefits of Ayurveda with modern medicine? Can you share some of these with much gratitude?
There are a lot of clinical trials which has happened individually on the herbs and also on the Ayurvedic concepts of Dinacharya, Panchakarma. For example, in the area of herbs, ashwagandha has been validated very strongly. Randomized controlled trials have been conducted. Curcumin has been validated, like the anti-inflammatory and antioxidant agent. That is what curcumin is. So in cancer prevention, in arthritis, in Alzheimer's disease, curcumin has been validated. Giloy, another Ayurvedic herb, also called Amrut. This is an immunomodulator, and studies are there for its immunomodulatory properties. and especially in autoimmune condition. So it helps regulate the immune system. So the research was focusing on its potential in managing metabolic disorders and autoimmune conditions. And Triphala has been validated. Triphala is a very powerful antioxidant and it supports gut microbiome health. So in that also studies were there. Brahmi has been validated. Brahmi is a memory enhancer, nerve tonic. So the mechanism of action also, it is validated according to the modern medical science. Like, for example, ashwagandha's mechanism of action, it is an adaptogen. And adaptogens, as we know, it acts on the hypothalamic pituitary adrenal axis, which is the body's central stress response system. So the key mechanism is the primary mechanism involves regulating this HPI axis. So when stress occurs, hypothalamus signals the pituitary, which signals the adrenal glands to release the cortisol. So ashwagandha helps dampen this stress cascade. So that is how it helps in reducing the serum cortisol levels. Ashwagandha also has studies have been there in its anti-inflammatory effects, antioxidant effects, because it has an active compound called withanolics, so which possess strong anti-inflammatory properties. So it inhibits the pro-inflammatory mediators. It is also an antioxidant. It's also a neurotransmitter. It gives neurotransmitter support because it has a mild effect on GABA receptors. So GABA is the primary inhibitory neurotransmitter in the brain. And by supporting its function, ashwagandha promotes a sense of calmness and reduce the nervous energy. It's very widely used by all the Ayurvedic physicians. So integrating both this, I'm not sure whether any studies have happened in the integrative field, but individually, a lot of quality control, clinical trials have been conducted in these herbs.
So I'll just add to that, the earliest antihypertensive that modern medicine had used was rezapine, a derivative of Rauwolfia serpentina. There were documented clinical trials published in Indian Medical Gazette, a modern medicine journal that no longer exists, were done in 1933 and 1934 from members of Indian Medical Service. And these were controlled randomized clinical trials suggesting efficacy of Rauwolfia serpentina extract in hypertension. So yes, there have been documented cases. I want to go to the next question. It is from Dr. Vineet Singh, who is a psychiatrist practicing in Canada. And he is asking you, Dr. Nisha, that dementia is a huge challenge for us as we are living longer. What is the strength of evidence in Ayurvedic medicine in treatment of dementia where modern medicine is somewhat lacking?
For dementia, it's only supportive care we can also do. Like Brahmi is used, ashwagandha is used, and the action of Brahmi in handling the nervous system aspect of bringing the memory down, that also has been studied. So we cannot reverse dementia or anything. It is only the supportive care we can do.
Okay. There's a question from Dr. Sushmita Jasti. Are there specific cancers or treatment stages where integrative approaches are particularly beneficial?
I would say in almost all the cases, the integrative approach will help. Keeping in mind with a lot of drug herb interaction, and also at which stage the integration should be. effectively happening. So we have treated almost 3,000 cases in the last few years. We have started looking into cancer care only last few years. So we had treated a variety, like a range of conditions, almost all conditions. Most of the cancers we have treated, and it is effective at every stage and in different types also. But basically, I would say lung cancer, breast, prostate, and all the stomach cancers, colon, digestive tract, and even in the leukemia. Actually, I would say in all type of cancers.
The next question is from Dr. Parul Agarwal. What percentage in Ayurveda is the role of diet and lifestyle changes and that of herbal medications?
For diet and lifestyle changes, I mentioned before also, only when your body is supported by enough nutrition, any condition will heal. So enough nutrition means it is not only, say, the modern medical nutrition. I do not know whether you have a nutrition as a part of your science, but the modern nutrition revolves around the quality of the food. But in Ayurveda, only half of it is the quality of food, and also the quality of food is assessed in a very different way. And half of the nutrition science depends on the Agni, your metabolic capacity. Like even though you take the most nutritious food in the world, unless your body can digest it, you will not be able to process it or use it. So that is why treating Agni and optimize your Agni is one of the main goals in treatment of any condition in Ayurveda. And it do have a major role in healing any kind of diseases, and also lifestyle changes. Unless the energies in you are balanced, healing will not happen. So that is why now in the practice we see that medicine alone cannot do anything. Cannot. It can address some symptom, mask some symptoms, and for a short while, but it never addresses the root cause, and it never treats the person as a whole.
So the next question is from Dinesh Gupta. Is there any institute where BAMS and MBBS students study together, learning from each other's systems? And then he says that BHU has some sort of such blending, specifically during preclinical training.
But years before, if I believe 30 years before, BMS doctors used to do allopathic science. So there was like a Vaidya from whom I learned in the initial days. He was both BMS and allopathic, but he practiced Ayurveda. But right now, in the last few years, it is not there. And now Ayush government is looking, and he have brought up a proposal for such a course, which is very welcoming.
So the next question is from Dr. Nagesh Borse, who is a health epidemiologist based in Washington, D.C. Basically, he is comparing the costs of the modern medicine versus herbal products or herbal medications, and is suggesting whether, in low income areas or rural areas where affordability is an issue, having availability of these herbal medications, having herb gardens that can be cultivated locally with educational support could provide better access to, resource challenged populations. Any comments?
Yeah, to bring down the treatment cost, we should have a broadened approach to how the availability of the medication. That we have a strong government support. Ayush Ministry is supporting for the research, and also bringing out the medicines cost effective. So that is definitely a need.
Okay. The next question is, what Ayurvedic practices can help those suffering from chronic pancreatitis and celiac disease?
We can, here also the integrative approach helps. No, there are medications like Calmeg, Guluji, Triphala, which is very effective in the gut tissues. So here we can have the allopathic intervention for diagnostic, for interventions for pain reduction or something, minimized interventions, and Ayurveda can treat the whole condition, addressing the root cause, which is an Agni imbalance.
The next question is from Parul Agrawal. Is there any geriatric section in Ayurveda and how different from modern medicine it is?
That is the question, how it is different, right?
Yeah.
Geriatrics is a separate branch of Ayurveda. Like we have 8 branches of Ayurveda. So one of that is geriatrics. And there are herbs which is suitable for that age to address the conditions of that age, and also treatment modalities which will help in the geriatric care. So they're also not much explored. Not much explored. The major branches of Ayurveda which is being explored is, one is the Kai Chikitsa, the general medicine, systemic conditions, then the gynec, Prasudi Tantra, and then we have the child, Kaumara Britya, the pediatric, ENT is there, Shalakya, and Shalya surgery is there, but it's not being practiced so effectively because surgery has gone much more ahead, and there is no sense to recreate the old one. But we can take the, and this is already, the surgical world is doing it, I think. There is a surgery called Indian surgery. The flap, the tissues are removed from the thighs and the nose is rebuilt. So that's a very interesting area, how surgery was practiced so many years before. So many of the instruments were there, anesthetic methods were there. So these are the areas which is very commonly practiced. There is one science for mental health, which is called the Manasika Chikitsa. That is also practiced very well. Geriatrics is not so much practiced, but we can do a lot in that.
So the next question is from Deborah Joy, and that is not for you, Dr. Nisha. The request is to put the link for Hindu Physicians International. I'll request Dr. Vikas Jain to put the link for Hindu Physicians International's website as well as the membership page that people can copy. So Dr. Vikas Jain will do that while we are taking further questions for next 7 minutes. There's a question/comment from Dr. Parul Agrawal. I am an Ayurvedic acupressure therapist and educator. I've seen in my practice since long that if lifestyle changes are not done, no medicine, Ayurvedic or modern, is effective for long term. Your opinion, please, Dr. Nisha.
Yeah, we already spoke about it. The diet and lifestyle plus the mind-body intervention is very, very important in healing any condition. Without that is why Ayurveda is called a holistic science, because it addresses different aspects of. So the treatment is always multidimensional.
So the next question is from Dr. Harshi Mathur, who is a physician based in Calgary, Canada. And she states that she has done a certification program in Ayurveda wellness counseling. And she has been counseling patients if they want want counseling based on Ayurvedic prevention principles. So she says that she is agreeing with you about integration and is sharing one of her friend was diagnosed with gallbladder cancer with secondaries in liver. He was advised palliative care and 4 months to live. I advised him to consult Ayurvedic physician. He did so in 4 months instead of dying. His MRI showed 90% improvement. Unfortunately, he did not continue with the treatment, and after 8 months, and cancer returned in 1.5 years, and he passed away. So, basically, endorsing some of the effectiveness of Ayurvedic approach to treatment. Any comments, Dr. Nisha?
Mm, yeah, of course, long term, it's not when you deal with a condition like cancer, it's not a 1 day or 1 week deal. We need to follow up, the patient need to follow up and to stay longer.
Okay. Dr. Sarita Patel is asking what is the role of pulse assessment and how can we collaborate with this disappearing science with modern medicine practice?
See, through pulse assessment, what is happening is we understand the constitution of the person, which we call prakriti, and also the state of doshas in the person, whether it is balanced or imbalanced. And if it is imbalanced, what is the impact on the body and mind because of that? Which system it is affecting, which organs it is affecting, and where it can lead you to. And even the prognosis. With the expertise, even the prognosis we understand through the pulse. So the role of pulse diagnosis come when even before it manifests into a disease, we can address the condition and use it as a prevention. And many times, no, my patients come and tell me, I have these symptoms. I saw a doctor, but doctor tested everything, did all the possible diagnostic assessments, but he couldn't find what it is. So there we can very exactly find what is happening in the body and we can address it. So I would suggest, like actually we have, including Sarita Patelji, we have some physicians who already been trained in Nadi Pariksha, in the pulse diagnosis. And I believe it is helping you a lot. When other ways of diagnosis falls, you know which energy, which dosha is imbalanced and what it is taking the patient ahead. So it would be a big additional diagnostic tool for an allopathic doctor too.
So we are running short of time. There are multiple
Yeah.
comments and questions in the chat room, and the link for Hindu Physicians International and membership page have also been put there, so people can register as free members of Hindu Physicians International. I'll just take one last question. It is from Dr. Nagesh Borse from Washington, D.C. He writes, the US FDA has continued to raise concerns over heavy metal poisoning in unapproved Ayurvedic medicines. As recently as last week, the negative publicity needs to be addressed within India. Manufacturers and QA, QC needs to be prioritized at the national level. And he sends actually a link to that FDA advisory. So, Dr. Nisha, what is your advice on that?
Yeah, exactly, because this is a racing concern and biggest challenge we also face. But there are very strict regulatory bodies in India where Ayurvedic medicines are made. So if it is a properly manufactured from a properly manufacturing company, it should not be a problem. I also agree with you. That is one of the problem we are also talking about. Like if I work with Shri Tattva Shri Ayurveda in India. In our factory, we follow all the good manufacturing practices and all the licensing which we need for USA, which we need for European countries. Everything is met with. So this is one of the things which we also will take it very seriously.
So there are many comments and questions, but we are running out of time and I don't want to extend the time. We really thank you from the bottom of our hearts at Hindu Physicians International to Dr. Nisha Manikantan for very eye-opening and very lucid lecture on bridging the modern medicine and Ayurveda. And as I mentioned, that Ayurveda actually is the mother of all modern medicines. All science are one. It's a question of our openness to accept scientific evidence in different formats, kind of thing. So I don't see any difference between modern medicine versus Ayurveda. If Ayurveda was not there, modern medicine would not have been there. Whether it is in the field of therapeutics or surgery or plastic surgery or whatever, there's a request or question whether the recording would be available. Yes, the recording indeed would be available within next 24 hours. We will edit this video and place the recording on HPI's website. We will also circulate the link to the recording in various groups, including WhatsApp groups. So yes, we do that routinely. Also, it will be available on the LinkedIn page of Hindu Physicians International. So there are multiple ways you will be able to access the recording of this presentation. And for our viewers, we are trying to do these lectures every 2 weeks. So try to join whenever there's a opportunity for you, time available for you. We circulate it, the brochure, on LinkedIn, in various WhatsApp groups, and on our website. So please start attending these. And if anyone is interested in giving a lecture, we'll welcome you. But our main focus remains on Seva. Naraseva, Narayana Seva. We encourage all you physicians, whatever background you come from, Ayurvedic, homeopathic, Siddha, modern medicine, to get involved in Seva besides your routine job or your routine life's earnings or vocation. And we will provide at Hindu Physicians International the platform for you to do your Seva activities. Thank you very much indeed, Dr. Nisha Manikantam again. And thank you very much indeed to all the audience members who took time off. You know, it's a Sunday morning here in US and Sunday evening in India, wherever people are joining for this particular one. We all thank you and hope that we will continue to have this kind of enthusiasm and interest in the activities of Hindu Physicians International. Thank you very much indeed.